Welcome to the show. We have some exciting topics to talk about as it relates to healthcare disparities. I want to get right into it. I don't want to waste any more time because these topics that we have to talk about are something that you really want to listen to and probably can answer some of your questions that you've been thinking about. So my first question is to you, Cynthia. Family dynamics as it relates to mental health. What are your thoughts on that?
Well, family dynamics can be very tricky as it relates to mental health. And one of my jobs as an RN is to help people handle their fears, um, and to help them deal with like the worst that can happen with it, if they can, how they live with it, what's the odds of happening with it. All these things relate to how you deal with mental health in general within the family dynamic. Um, as a nurse, I spend most of my time actually coordinating care with other people. So I'm not actually always in the room with the patient as long as I would like to be, or the client, or the individual, or the human that I'd like to be in the room with. So I have to get a lot of information really quick. And with that, I have to be able to look for unforeseen difficulties or problems in dealing with everything that entails, like medications and teaching and documentation, and any objective information or even subjective information can be important too. Like, do you like music and does that help calm you? So I only spend about 25% of my time with a patient, unfortunately, because of all the documentation I have to do and everything else. And that documentation is important for the rest of the healthcare team so that they understand what is going on with not only just the condition of maybe the chronic disease or illness that you may be facing, but how that relates to the mental health aspect of maybe that could be leading into that disease, or maybe the disease is leading into that. And that helps us understand that. And I have to write all of that stuff down as concisely as possible.
Yes, very important. Very important.
There's also an emotional aspect to my job. I do give a little bit of advice and I try to calm people down. And I'd like to have empathy as much as I can for people that are suffering, because there's a reason why nurses became nurses. A lot of us have seen either someone dealing with something or in our personal life, in our own families ourselves, and we want to see how we can help out with that healthcare to make it better for our communities and for whoever we can touch. All these actions are all the actions that I do aren't just for the patient, though. They are for the entire family.
Yes.
Um, let's see. I keep saying Miss
Well,
Gayla.
Brenda, what do you have to say about this?
Thank you, Gayla, and also Cynthia. Um,
Brenda,
family,
first of all, Brenda, I'm sorry. For my audience, this is our this is our second show. Me and Cynthia did the first one. Oh, and it was fun. Okay, so we're going to get better on these shows. But Brenda, can you tell us just a little bit about yourself?
I am, name is Brenda Brown. I am my degree is in health care management, and I also have a certification in coding. And I
Is that
have
medical
worked,
coding?
yes,
Medical
medical,
coding? Yeah.
yes, billing and coding. Thank you.
Mhm.
And so I've been doing that for over 25 years now.
Long time, long
Yeah.
time.
And when I look in terms of family dynamics and how it relates to mental health, family relationships can be substantially affected by mental health, not only mental health, but behavior and even physical health. There's numerous studies that have shown that social relationships, particularly family relationships, can have both what we call long-term and short-term effects on one's mental health.
Mm.
And this depends on the nature of these relationships. And mental health can also be enhanced both impactfully by positive and negativity. Now, when we look in terms of, I'll talk about 3 areas: the positive mental health impact with the family, family and negative mental health impact, and also how this negative aspects of family dynamics and health affects individuals in marriage. When we look in terms of the positives, when the family has a relationship that is stable, supportive, and also the individuals are getting treatment, that is a positive response for that individual who needs help. Now, when you look in terms of negative mental health impact, this can cause a whole lot of stress. It also can cause physical symptoms, and it can cause illness that gets worsened over time. And another area is in a marriage. There is increasing evidence that poor quality relationships can actually harm physical and mental health. However, persons in unhappy marriages exhibit the worst physical and mental health than unmarried people.
Mm.
Marriage is characterized by an unequal division of decision-making and power that are associated with high levels of depression on the part of spouses. And when individuals grow up in and see this in their parents' relationship or the ones who's raising them in relationships such as that, they grow up in what's called unsupportive, neglectful, violent homes, and these are all associated with poor physical health and development. So that certainly is crucial to individuals as it relates to the family dynamics and as it relates to mental health. I'd like to now turn it over to Jacqueline. She is going to be discussing the importance of your annual wellness check and how to better communicate with your doctor.
Hello, Jacqueline.
Hello, everyone.
Can you tell us a little bit about yourself?
Sure, and I'm so glad you invited me to be a part of this forum.
Yeah.
My name is Jacqueline Mayhew, and I have a bachelor's degree in behavioral science, and I just recently completed within the last year, master's degree in human resource strategic management. So I'm delighted to be here. The importance of your annual wellness check and how to better communicate with your doctor. I find it to be a very, very crucial thing, or that many of us need to really pay attention to. So the importance of your annual wellness check is that it gives you the opportunity to talk with your doctors about any issue you're having. Many times you may have symptoms such as swelling or forgetfulness, which may be precursors of something serious and can lead to a diagnosis. So it's just very, very important to be upfront with your physician and try to, be comfortable with whatever physician that you choose. I'm going to talk about 9 ways to get the most out of your annual checkup. Number 1, actually make it there. You make that appointment.
Very important.
Please go. It's important to get there. If you don't get there, you can't get your checkup. It's just as simple as that. Keep your appointment each year, even if it means setting a mid-year calendar to nudge yourself. Appointments that you make from year to year, especially for women, we have our yearly mammograms. You could take a mammogram or have your mammogram done in 2020, and then in 2021, if you miss that mammogram and then go in 2022, you may find some developments that had happened and you don't know why. And it would be really hard to pinpoint it because you skipped that one in between where it could have been caught.
Yeah.
If there was something that showed up on the mammogram, it would have been detected. So very, very important to keep those annual appointments. Number 2, bring notes with as many details of your medical history as possible to your appointment. Sometimes we get to the appointment and we get flustered. We could be intimidated because we're talking to a physician, or, we just forget. We don't think that some of the things that we have been experienced is important, when everything that you are going through or experience or feel in your body is important. So bring notes. Number 3, tell your doctor about every medication or drug you take, including supplements.
Yes.
It's so
Oh my
very
goodness,
important.
so important. Yes.
Absolutely.
So important to let your doctor know, because from year to year, things happen. You may go to an urgent care and a doctor may prescribe something for you. You may pick up supplements, which are just the things that you buy over the counter that you think that does not have any part of your health care, in which it does. So it's so vitally important to tell your doctor about all the medications you're taking. And I would also put on that list the ones that you're not taking, because sometimes we stop taking medication. We may stop because we forget why we're taking the medication. So all the medications that you have on your list that and it might be even important to start just making a list, because from year to year, things change.
Yes.
You may not need a certain drug anymore, or you may need an increase in that drug. So make sure you bring a list of everything you taking. Number 3 or number 4, be vocal about what you want from the visit from the very start.
Mhm.
So when you go into that exam room and the nurse comes in and she asks you, what are you here for? Make sure you are very, very specific about what you are there for.
And it is not a cup of coffee.
Exactly.
Right.
Though it's free. It's not the coffee. I'm here because I've been experiencing whatever it is you experience. I can't sleep. Sleep can be a precursor to, or the lack of sleep, to something else going on inside your body. I'm here because I've been having these headaches and they're increasing or they're intensifying or whatever the case. You really need to, I'm not going to say you, I'm going to say we, because me included, and just be real specific about what it is we're feeling inside our bodies, because not everything is natural, okay, that you're feeling. Number 5, bring up any health issue you think you need to see a specialist for, because your primary care physician, your PCP, might be able to treat it instead. Now, that can be a big issue when it comes to insurance. And so, as long as you are being very specific about what it is you think you need to see a specialist for, sometimes your primary care doctor can handle that and take care of those issues. So if we don't tell them, oh, I need to see a specialist because I feel like I'm growing a third toe or something like that. So, God forbid, your primary care doctor can probably get the x-ray. You don't really need to see the specialist to get an x-ray. So the primary care physician can give you that referral or send you to the x-ray to get that photo taken. Let's see, maybe you really are growing a third toe, or maybe it's just something in your mind. So a lot of times, talk with your primary care physician. That's what he or she is there for. Number 6, come with a list of questions you want answered, instead of telling yourself you'll remember them all, because you probably won't.
That's so very true. You won't. You get in the doctor's office and then your mind will just go blank.
See? So when you think of these questions, write them down. Eh, Simple, I get up and go to the bathroom 3 times at night. That can be an issue. Um, I'm eating and I'm burping or I'm belching a lot. That can be an issue. So write down these things. How even significantly you think insignificant they are, it could be very significant to your care. Number 7, also ask for a reality check about those health symptoms you Google. Okay, who can all be guilty of that? We Google everything. Google becomes our doctors sometimes. Instead of going to the doctor. Well, I Googled, my hair was turning white. Why is my hair turning white? Well, Google can give you answers, but then there could be some other significant health issues that you have of why your hair is turning white. So don't rely on Google. Don't rely on Google. Google didn't go to school 12 years to get this surmountable information that your doctor has. And even if you think your doctor doesn't have it, I guarantee you he's going to go back to his office. He's going to pull out one of those big old fat books up on that desk. And he's going to go into that book or talk to one of his colleagues, which they have many opportunities to do. So please do not rely on Google. Google will cause you to have sleepless nights. It will cause your hair to fall out. It will cause so many chain reactive things that you don't want happening to your body unnecessarily. So be careful of Google. The number 8 thing that I have on my list is be 100% honest about your vices, like alcohol and drug use, because that helps your doctor look after your health. Contrary to belief of many people in our community, when I say our community, I'm speaking of minorities. We don't realize that alcohol is a substance that can alter our cellular output. It changes things in our body.
Can we say the Black and brown community? Because
Sure.
minority could be women too. So the Black and
Okay.
brown community. Is that
Let's
where
say
we're going?
That's Black and brown
All right.
communities. Yes. Alcohol and drug use can alter many, many things. It can make you, when you have pain, it can alleviate it and you don't even know you have pain. It can make you feel like, oh, I'm okay. Now I can go and run the 100-yard dash, when in actuality, it's masking, right, Cynthia? It's masking the real issue. So we got to be upfront and be honest with your physician, because the other point of that is they could prescribe you medication that will react to the alcohol or the drugs in your system, and it won't be favorable. Okay.
And let me just say this too. A lot of people don't understand that, and this is to our audience, that the doctor's going to know. They're going to take a blood test.
Right.
Ooh, they can see it through your blood. So I wanted to share that with everybody. Even if you might not want to share that, they will see it when they do a physical and they take your blood tests.
That's right. And the last thing that I wanted to share with you is, don't be afraid to break up with your PCP. That's your primary care physician. Don't be afraid, and find someone you're more comfortable with. And even if you've had your physician for 20 years, part of the relationship of your health is your relationship that you have with that doctor, whether he's male or female. If you're not comfortable, I have a couple of physicians that I will see only because of my because I'm a woman. I'll go see my primary care physician who is a male and trust him with everything about me and every aspect of my life and my children. Been with this doctor for 30 plus years. So him I trust. But when it comes to women's health, I see a female. It's okay to go see a female gynecologist, someone that I am comfortable with, who can talk about the female body and body parts, and if she has to do exams, and which includes the touch, that I am comfortable with, even though I've known my other physician for 30 plus years. So it's okay to find someone that you're comfortable with, because if you're not comfortable, you won't do the exam, or you won't be forthright and upcoming about your personal issues that you're having with your body. So thank you for allowing me to share all that, Gayla.
Thank you so much, Jacqueline. Boy, I like that. She went in so much detail for us. She did it 1 through 9. I want to tell our viewers too, if you want to reach out to Jacqueline, there's my number on the Zoom. You can call it, leave a message for her if you have some questions for her, and she can call you back. Now, allow us time to call you back, at least 24 to 48 hours, but we'll make sure that she will definitely call you back. That was so enlightening to that. So let's go down. You know what? This we talked about our family dynamics, suicide among youth, adults within our criminal system. Cynthia, do you want to share any last minute thoughts on that?
Last minute thoughts on suicide. Well, actually, I had some last minute thoughts on the other thing. I do want to mention really quick about like alcohol and drug use in the Black community, or in Black and brown communities, and communities in general. A lot of what we did with alcohol and drug abuse was really, as things turned into pharmaceuticals, people would be able to get stuff on the streets and stuff and handle their medications that way, technically. Right. And so for some people, access to healthcare in general is very difficult, and they need access to something that's going to get them out of pain, or maybe to get rid of that headache. They got to drink so many drinks a day, but actually makes it worse because, as you said, Jacqueline, you have cellular changes. So now the cells require the alcohol, and you have to keep upping the ante on the alcohol. So yeah, absolutely. And definitely talk to your doctor about that, because they may be able to provide a remedy and actually back you off of that so that you feel more normal. But I did want to mention that. And Google being your friend. Okay, Google can be your friend. It can be a little bit. Don't worry so much about it, and go ask some questions. Absolutely. Making sure that you put yourself, even as a nurse, I'll Google something thinking that I understand the disease process. I have to do like hours of research once I accidentally stumble onto something that freaks me out. Mm-hmm. So that I can go understand like the cellular process better and how that works. And if maybe like, favorite one, WebMD, says something that I'm like, it's cancer.
Like, wow, I understand. We Google everything.
Right. And so I may need to understand that cellular process a whole lot more using the knowledge that I've garnered through the practice of healthcare. So, and I have to also then call out to people and go, hey, let's talk about that, because I think I might be looking at this wrong. So yeah, absolutely. Take the time to talk to whoever your provider is.
And Cynthia, just to add to that, I did have a personal experience with my 2 older sisters. My oldest sister, she had breast cancer. My second oldest sister did not. After my first oldest sister got her mammogram and went through surgery and all of that and had her breast removed, My second oldest sister missed 1 year. And when she missed getting that mammogram that next year, believe it or not, just as Jacqueline mentioned, she did have breast cancer that following year. It was in the same breast, in the same area as my oldest sister. Now, how is the likelihood of that with two siblings having the same issue in the same breast, in the same area? And they
Genetic.
both had to have mastectomies.
Genetic,
So it's
yeah.
very, very important for our audience to remember, get those annual checks, just as Jacqueline said, and write it down. It is so important. I even keep in my wallet a list of my medications on an index card.
Mm.
I also put on there emergency contact numbers, such as my husband, my children. And I do that because a lot of times our cell phones are locked.
Yep.
So if you were in an emergency situation, and they couldn't get into your phone
Yeah.
because it's locked, because you've got to have a password, how are they going to reach my husband? How are they going to reach my kids in an emergency situations? So I teach CPR classes, and I always tell the students, the residents, the physicians, nurses, and so forth, put that emergency contact information where someone can reach it. Because if you are in an accident, they will look in your wallet first. They're going to be looking for, who are you, by your driver's license. And then secondly, if you're allergic to anything, put that on that card.
Very
Put
good.
some information in your wallet that's about your emergency contact, what you're allergic to, because otherwise, how are they going to know in an emergency situation? Audience, I know that veers off just a little bit, but hopefully that information will help you.
Very good, Brenda.
Thank you.
Jacqueline, you have any last minute thoughts you want to share with us? All right. You sure?
Yeah,
Thank
I think you ladies hit it all very well.
Okay. All right. Well, that concludes this topic, these three topics that we have for the show. And thank you very much, audience. And to our co-host people, hey, Cynthia, hey, Brenda, hey, Jacqueline. We'll see you guys again next week. Bye-bye.
Thank you.